So it's time for our keynote address, and I'm absolutely thrilled to introduce Dr. Camara Jones as our speaker. I'm so honored that she has been able to be here today, given her incredible schedule. I don't know quite how she does it, but she's here today, and so I'm really thrilled. By training, Dr. Jones is a family physician and epidemiologist whose work focuses on the impact of racism on the health and well-being of the nation. If you know anything about her, then you know that she has long been a powerful voice in broadening national health debates to include not only universal access to quality health care, but also to the social determinants of health equity and social determinants of health and equity. And if you didn't already know that, you're about to find out. I myself have been following Dr. Jones's work since I was but a postdoc so many moons ago, and I've just continually marveled at the clarity, rigor, and creativity she brings to the work that she does, and to analyses of health in this country. Her writing on racism makes it almost impossible to fail to grasp why racism is a cornerstone in the health inequities in the United States, even for those whose jobs depend on not understanding. As president of the APHA, the American Public Health Association, she has begun leadership of a national conversation about and campaign against racism and other structural inequities. And this is a collaboration that's taking place between APHA and other national organizations. You'll see she's an incredibly dynamic speaker, and so it was no surprise that at last year's meeting at APHA, she spoke in a room that was many, many times the size of this room, and it was packed to standing room only. As well, if you were there, you would have seen that all who were in the room were very much committed to the initiative that she's leading. She's garnered a breadth of partners who are eager to move forward with this important initiative around racism. And so, in addition to holding the presidency of APHA, Dr. Jones is currently an adjunct associate professor at both the Morehouse School of Medicine and the Rollins School of Public Health at Emory. She's a member of the World Health Organization's Scientific Resource Group on Equity and Health, and a member of the National Board of Public Health Examiners. From 1994, she was an assistant professor at Harvard University School of Public Health and a medical officer at the Centers for Disease Control and Prevention from 2000 to 2014. So please join me in welcoming Dr. Camara Jones.
Good morning, everyone. Thank you, Dr. Kwate. I'm really honored to be here because to hear these conversations, to hear these very concrete examples of how people are struggling to improve the conditions of our lives, and especially paying attention to inequity, I'm going to be learning a lot. What I wanted to do this morning was actually, because as the president of the American Public Health Association, we are launching a national campaign against racism. And at the end of my talk, I'm going to tell you how far we are in terms of concrete ways that you all can become involved in that national campaign. But I also know I'm speaking to an audience of collaborators and people who already understand probably everything that I'm going to say. So what I'm going to share with you is not new information necessarily, but new ways of framing that information and new ways of communicating that information. I'm calling it tools for a national campaign against racism. And often, as president of APHA, I am speaking to a health audience. And so I often start broaching gently, kind of, creeping up to the fact that we must speak about racism as a health intervention with a cartoon animation that I call my cliff analogy. Okay? So I'm going to start right now with my cliff analogy, which is about levels of health intervention, which will make it quite clear why addressing racism as a root cause, as Dr. Cooper talked about, let's talk about root causes, as a root cause of health issues. So here we go. Whoops! Boom. Somebody just fell off of the cliff of good health. And if that were you or somebody in your family, you would be delighted to find an ambulance at the bottom of the cliff to speed you on to care. But if you were concerned about others who might come along that cliff face, if you were concerned about population health, public health, community health, you might well ask yourself, well, what could we put in place as a health intervention besides just stationing lots of ambulances at the bottom of the cliff? So I know somebody in this room is going to say, I know, let's put a net halfway down. Because even if we know that people will fall, we can catch them before they get crunched up at the bottom. And that is an excellent idea. Although when you think about it, nets do have holes in them. So, some people might fall through the cracks, but we could make that a trampoline halfway down, right? No holes in a trampoline. But even if we have a trampoline halfway down that cliff, we might very well find ourselves with lots of people just bouncing up and down at half functionality, not able to get back to the top of the cliff. So, what else could we put in place as a health intervention? Well, clearly we need to be thinking about a fence to keep people from falling in the first place. But that's going to have to be a really, really strong fence if there's a lot of population pressure against it. So, what else can we do as a health intervention? Well, we can move the population away from the edge of the cliff. So what I'm going to do right now is label the interventions that I've described so far, where the ambulance at the bottom of the cliff represents medical care, and what we on the public health side of the house describe as tertiary prevention, because we think about 3 levels of prevention: primary, secondary, tertiary, where tertiary prevention is preventing the complications from disease that's already manifest. So that's your ambulance. Well, your net or trampoline halfway down, these are safety net programs and what we call secondary prevention, which is early detection, screening programs. Safety net programs might be in our social services and the like. The fence represents primary prevention, keeping things from happening in the first place, which can have a policy aspect as well as in the strictly health thing, it's things like immunizations. And moving the population away from the edge of the cliff is about addressing the social determinants of health. Now, on the health side of that, we call everything else that you guys are doing the social determinants of health. I know that you call, we're very health-centric in health, right? And then I know that you call your food policy or criminal justice policy or transportation policy or economic development policy. You're not thinking about health. But we call all of you guys the social determinants of health. So, it's true. So, those, when we think about health, those are the determinants of health that are outside of the individual. They're beyond our genes. They're beyond our individual behaviors, and they are, in fact, the contexts in which our behaviors arise and in which they convey either risk or protection. So when we think about these, we think about individual contexts like education, occupation, income, wealth. So poverty would be a huge social determinant of health. We also, though, think about neighborhood context. So that's when you talk about food policy. When you talk about, are there jobs in the neighborhood? And if not, is there even transportation to a job? How safe is it to do the health behavior thing of walking in your neighborhood? Are the streetlights there? Are the youth being hunted down? What are the environmental hazards around you? What are the occupational hazards that you have to endure on your job? So that's all what we call the social determinants of health. And actually, this diagram could be useful for starting a community conversation about where should we be putting our health money, right? How much in ambulances versus nets versus fences versus moving the population? And we need all of it. We all want that ambulance there when we need it, right? But it's a matter of emphasis. We could actually go to the US Congress and have a conversation around this and health inputs. But as useful as this might be so far as a communication tool, it has a huge fatal flaw, which is that so far, it does not talk about how health disparities arise. So I want you to keep this cliff in the back of your mind, but we're going to shift gears for just a moment to talk about how health disparities arise, and then we'll come back to the cliff. So how do health disparities arise? And especially when we're thinking about racial ethnic health disparities, which have a very long history in our nation's life, and which are very pernicious and across all different kinds of health outcomes. When we think about how racial ethnic health disparities arise, we first of all have lots of evidence about differences in the quality of care within the healthcare system. The Institute of Medicine released in 2002-2003 its Unequal Treatment Report, which pulled together what were then hundreds of studies documenting even if everybody's in the VA system or everybody covered by Medicare or Medicaid or in such and such health system, there were differences by race and ethnicity in how vigorously your chest pain might be investigated and treated, depending on your race. There were differences in how much pain medication you would get in an emergency department if you presented with a long bone fracture, depending on your race or ethnicity. So the IOM put together all these studies, and it was quite a revelation to health providers. They were like, oh, no, not us, but yes, oh, yes, us, you, right? But even that IOM panel recognized that was not the only level at which health disparities arise, because they said, hey, some people can't even get access to health care in the first place. That's a second level at which health disparities arise in this country. But then I know that everybody in this room understands that health is not created within the health sector. So there's a huge third level at which health disparities arise, which are differences in the conditions of our lives, differences in our life opportunities, exposures and stresses, which are making some individuals and communities sicker than others in the first place. And when you think about these three levels at which health disparities arise, differences in quality of care, differences in access to care, and differences in underlying exposures and opportunities, really you could draw it as a pyramid. Or better yet, you could represent it as an iceberg where the huge hidden base are the differences in the conditions of our lives. And then it is very often the same people who've been made sicker who are the ones who are frustrated because of limited access to the healthcare system. And then even the lucky ones who get into the system are sometimes further injured because of differences in quality of care. So now with this in the back of our minds, we're going to go back to the cliff. But now we're going to recognize that we're really not dealing with a flat two-dimensional cliff, but actually we're dealing with a three-dimensional cliff. And at some parts of the cliff, there might be an ambulance there, but maybe that ambulance has a flat tire. So it's slow or goes off in the wrong direction. Or maybe there's no ambulance there at all, and maybe there's no net nor fence, and usually at those parts of the cliff, the population is being pushed closer to the edge. So now I'm going to label these observations about this three-dimensional cliff with how health disparities arise, where the differences in quality of care, that's represented when the ambulance is there, but it's slow or goes off in the wrong direction. Differences in access to care, that's no ambulance, no net, no fence. And differences in underlying exposures and opportunities are represented by the closer proximity of that greeny population to the edge. So now that we recognize that we're dealing with a three-dimensional cliff, which is actually quite a revelation to many people, right? Because they only stay on their part of the cliff, right? They don't even venture, they don't even understand. But now that we recognize that we're dealing with a three-dimensional cliff, there's a whole new set of questions that arise. The first, of course, being, how did the cliff become three-dimensional in the first place? And that's usually because of historical injustices that are perpetuated by present-day contemporary structural factors. But given that the cliff is three-dimensional, we also need to ask, why are there differences in how the resources are distributed along this cliff face? And why are there differences in who's found at different parts of the cliff? Why are the oranges back here in a way and the greenies being pushed closer to the edge? And when you start asking and addressing these kinds of questions, you're now doing what I describe as addressing the social determinants of equity, which actually differs from addressing the social determinants of health. Addressing social determinants of health is moving the population away from the edge of the cliff. Addressing the social determinants of equity is trying to figure out something about systems of power that can distribute resources and populations, where these social determinants of equity include racism, sexism, heterosexism, economic systems like capitalism, and the like. And actually, with this cliff, I have distilled three different dimensions of health intervention. So if you go back to your junior high or high school geometry, where one dimension is a line, 2 dimensions is a flat plane, 3 dimensions is space, actually along that line at the edge of the cliff is where we can display all of our health services. So our curative and preventive health services. This is the conversation that we've had as a nation over these past many years about what became the Affordable Care Act, right? If you say the word health in this country, most people will go immediately to health care or health services. And in fact, you know, everybody in this room, I would hope, would endorse the notion of universal access to high-quality health care, right? But that is not because that in and of itself, as I've already demonstrated with the cliff, would result in large and sustained improvements in health outcome or the elimination of health disparities, because you can overwhelm any system, right? But the reason we want universal access to high-quality health care is because that's how a civilized society values all of its people equally. That's why we need that. But we recognize that as wonderful as that, you know, as fast as the ambulance is, and as strong as the net, and as strong as the fence, we must move into that second dimension. We have to move the population away from the edge of the cliff, which we can display in a flat plane, if we're going to have large and sustained improvements in health outcomes. So that means that we have to address the social determinants of health, including poverty, and actually, as I said, including food policy, including transportation policy, including this. I'm actually, in a simplistic way, going to put addressing the subjects that we're talking about today as moving the population away from the edge of the cliff. We must do that to have large and sustained improvements in health outcomes. But the risk here is that if we move the population away from the edge of the cliff without recognizing that we're really dealing with a three-dimensional cliff, we are at risk of actually making health disparities worse. And so we have to acknowledge and address the three-dimensionality of the cliff. And we need to name and address these social determinants of equity, including racism, sexism, heterosexism, and the like, if we're going to achieve social justice and eliminate health disparities. I'm going to talk much more about racism, in fact, because, we're the exact perfect group to have a conversation right now, but I know, given just what we started so far, that if I open it up right now, that I would never get back. So I want to entertain maybe just one quick question right now, if there's something burning, or at any time really, if you have something that you say, oh, I know this has to add to the conversation, or I don't believe what you said at all, I want to challenge that, or even an amen. At any point, just, raise your hand, but is there something right now? Thank you. Okay. Thank you. And I have to just say that often I'm speaking to a health audience. Sometimes I'm speaking to medical students or physicians who are really trying to be the best ambulance driver that they can be, right? And so it's important for them, first of all, to recognize that all of this other stuff is part of the health endeavor, even as it's not just health endeavor, it's the food endeavor and the transportation criminal justice endeavor. But the other thing is, wherever you are on this cliff, as your day job, it's important to recognize that as a citizen, we need to all be about especially addressing the social determinants of equity. That is my challenge to all of us. And in our work and outside of our work, we need to recognize that all of this is part of all of our work. So now I am going to focus specifically on one of those social determinants of equity or of inequity, racism. And when I say the word racism, I'm clear that I'm talking about a system. So I am not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested. I am talking about a system of power. And a system of doing what? It's a system of structuring opportunity and of assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on the social interpretation of how we look, which is what we call race in this country. Now, some people be like, what do you mean social interpretation of how we look is race? Because if you grew up in this country, you think race is so clear. You could just, you know somebody's race immediately. But if you did not grow up in this country and you've moved here, you know that you had to learn how to appropriately assign race. And furthermore, if you've traveled outside of this country, no matter who you are, you may have gone to another place where your race is different. In fact, if you were 100 years ago in this country, you may have been Irish and not white, right? You know what I'm saying? So this thing of race is quite malleable. I live in Atlanta, Georgia, where I am clearly black. But I have to tell you that in some parts of Brazil, I have experienced being just as clearly white. In South Africa, I have experienced being clearly colored. So here I am, same physical appearance. But the social interpretation of my appearance in those three settings has assigned me to three different racial groups. And furthermore, if I were to stay in any of those settings long enough, then my health outcome would probably take on that of the group to which I've been assigned, even though I'd have the same genes in all three places. So here I'm defining race as the social interpretation of how one looks, and racism as the system of structuring opportunity and assigning value based on that so-called race. Well, what are the impacts of this system? Well, when we think about or talk about racism at all, which is not often enough in this country, but when we do, we understand that racism unfairly disadvantages some individuals and communities. But it doesn't take very long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country. It's difficult, it's a challenge, but I'm going to share with you by the end of this talk an allegory that will even help us talk about that. But even as we recognize, okay, we have a system that's either unfairly disadvantaging or unfairly advantaging individuals and communities. It's also important to understand that racism is sapping the strength of our whole society through the waste of human resources. And I could give you many, many examples of that, but I'm just going to lift up two today. The first is how we as a nation are not vigorously investing in the full, excellent public education of all of our children because thank you for that, amen. Thank you. Because the blinders of racism have made us feel there's no genius in the barrios or in the ghettos or on the reservations. You know, we can get along very well, thank you, without those children. But of course, there is genius in all of our communities. And if we were to just vigorously invest in that genius, we could be doing so much better as a nation or even as a world. I am fond of saying we would already be up on Mars farming if that were a good idea, if we were to invest in all that genius. But then, you know what? We wouldn't even have to go to Mars. We would already be solving the problems in our communities on Earth if we were to invest in all of that genius. A second example of how these same blinders that don't value all of us equally sap the strength of the whole society is how these blinders have made us complacent with what I describe as the wholesale warehousing disproportionately of so many black and brown men in our prison system, as if that did not separate us from human potential. And if we know folks who are either stuck in prison or cycling in and out, we already got examples of how people are trying to address this through food and all, but people cycling in and out, sometimes coming out can't get a job, sometimes can't get housing, in many states can't vote. If you know any of these people, you know there's so much genius caught up in that system that if there had only been some other way they could be contributing very productively to our society, then you understand the extent to which racism is sapping all of us. And in fact, of those three bullets that I have on this slide, I think the most important one perhaps is for us to lift up how racism is sapping the strength of the whole society, to do data analysis that demonstrates that. It's a challenge to any students that are here in this audience, to do media stories, to have conversations around our own dinner tables. Because to the extent that we as a nation understand that racism is sapping the strength of the whole society, to that extent we will have more people engaged with a sense of urgency for dismantling this system and putting in its place a system in which all people can know and develop to their full potentials. But then, so this is a nice definition, understand it's a system and these impacts and all, but how does racism turn into health impacts? And here I am, I'm a health person. I know I'm surrounded by lots of people who are not health, right? So we could actually, and you'll see when I talk about how it turns into health impacts, I bring all of you guys in. But I think it's useful to think about three levels of racism: institutionalized, personally mediated, and internalized, which I'm going to define for you, give you examples, and then illustrate with one of my teaching stories, one of my allegories, my gardener's tale. So institutionalized racism is the system, if you will. It's that constellation of structures and policies, practices, norms, and values that results in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator. This is the kind of racism that's been institutionalized in our laws, in our norms and customs and policies, background, everything. And in fact, it often shows up as inherited disadvantage or its reciprocal inherited advantage. We see it in terms of material conditions and in terms of access to power. So specific examples include differential access to quality housing or equal educational opportunities or equal employment opportunities or even the same level of income at the same level of employment by race. And these things clearly impact health. Differential access to medical facilities, including linguistic access, or differential access to a clean environment, and the whole disproportionate placement of toxic dump sites or bus transfer stations and the like in communities of color. And I used to just stop there, but hey, Flint, Michigan, right? Oh my God. And would that have happened any other place? And would 4 cities in Michigan that include 50% of Michigan's population be under emergency management when there are other cities in Michigan with failing fiscal situations who are not under emergency management, where that emergency management even takes away the citizen, the democracy, the power over the self-determination, right? Institutionalized racism also shows up as power, which can be power as information, health information, or information about our own histories. Power as resources, capital resources, networking resources. Power as voice in government, media, and the like. Now, when I am speaking to a health audience, especially people who are really about addressing the social determinants of health, I have been challenged to look at more closely at that top bullet because they say, Dr. Jones, isn't housing, education, employment, income what we call social class? Why do you even have that on a slide about racism? Are you talking about racism, or are you really talking about social class? And that's an important question, and so I'm going to answer it. And the first part of my answer starts with the observation that it doesn't just so happen that people of color in this country are overrepresented in poverty while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical insult. So for American Indians, it was the taking of the land and the near genocide, and then the moving of the survivors to reserved lands, reservations. And then in some instances, something good was found under one reservation. Oops, you got to pick them up and move them somewhere else. We have people who for centuries have been living in what was Mexico and then became New Mexico and Texas and California, and their children are still being harassed, right? You have, we could talk about Chinese laborers brought here to build the railroads, unable to bring their families, unable to marry. Internment camps during World War II of Japanese citizens. We could talk about the kidnapping of West African people and our importation across the Atlantic with tremendous loss of life in the Middle Passage, and then for the survivors and their progeny, what I describe as the coerced usury of our unpaid labor for centuries to build this country, right? But then people stop me there. Oh, Dr. Jones, there you go. Little too far. There you go talking about slavery. They say, we recognize that slavery was an unfortunate chapter in our nation's history. But Dr. Jones, the enslaved people were emancipated by 1865. And we're in 2016. That's 151 years ago. So Dr. Jones, all else being equal, don't you think that the impacts of slavery would have washed out by now? But the key phrase there, of course, is all else being equal. And all else has not been equal since 1865, and all else still is not equal today. And there are still what I describe as contemporary structural factors that are perpetuating each of those initial historical insults. And these contemporary structural factors are part and parcel of institutionalized racism. So when somebody asks me, are you talking about racism, or are you really, really talking about social class? I say that institutionalized racism explains why we even see an association between social class and race in this country. That's a very important aha. It means that I know that it's important for us to eliminate poverty across the board in this country. You do not have to convince me. I would go further. I would eliminate income inequality. I would flatten the whole thing out, I sometimes say, give me that magic wand today, because I use it, ding, 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 done, okay? But if I had such a magic wand, and if I applied it immediately, but I did not pay attention to the background structures, policies, practices, norms, and values, the background mechanisms of institutionalized racism that were put in place to differentially shunt different populations into different possibilities. If I had eliminated poverty and eliminated income inequality without addressing institutionalized racism, within 20 years, within one generation, we would start to see a stratification by race in terms of income again. And that's an important aha for all of us who are in the policy field. We cannot just do our thing about poverty or food or transportation without addressing the mechanisms of institutionalized racism, which I will lay out how do we get to that in just a moment, okay? But before I leave institutionalized racism to talk about the other two levels, I also need to say that it can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission, and very often institutionalized racism shows up as inaction in the face of need. Flint, Michigan. Personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. So this is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the prejudice, the different idea, and then the discrimination, the different action. This is what some people call interpersonal racism. I call it personally mediated racism because I'm still understanding racism as a system, and this is the system mediated through people. So I'm not putting it in people. This is the system mediated through people. And this is where, you know, all the conversation about implicit bias and all is right here. How could this impact your health? Well, police brutality. Honestly, I've been telling this story and sharing these slides for decades now. And I used to say, imagine you were pulled over for driving while black or driving while Latino and then interpreted as resisting arrest and hit upside the head or worse. But now I and all of you could just list a litany of names, right? We could talk about Mike Brown or Eric Garner, or I think Laquan McDonald. Craig Futterman is probably going to talk to us about Laquan McDonald, or Sandra Bland, or little baby Tamir Rice, or on, Walter Scott. I mean, we could just lift up a litany of names of police brutality without accountability, so that it not only is affecting the lives of those people who have been cut down and their families, but the communities, because of the lack of accountability, who are just bracing ourselves for the next occurrence. Physician disrespect can be quite subtle, like a physician not giving a patient the full range of treatment options because the physician figures, well, that patient couldn't afford or wouldn't comply or wouldn't understand or whatever the assumption is, or it could be quite blatant, like sterilization abuse, which has had many iterations in our nation's history. Shopkeeper vigilance, being followed around in stores to make sure you don't steal, not even may I help you, but just like under surveillance, right? Or waiter indifference, not getting quick respectful treatment. And these are two examples of what some people call everyday racism, kind of the microaggressions, the subtle communication of disrespect that might even be related to elevated blood pressures in communities of color, blood pressures that don't even go down at night. And teacher devaluation, that's a very important manifestation of personally mediated racism, because if a teacher looks at a young child and thinks, that child can't learn, and puts that child off into the ADD track, that child will never even know their full potential, much less have the opportunity to develop to their full potential. And like institutionalized racism, personally mediated racism can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. But even more important to recognize is that personally mediated racism can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism that I describe, internalized racism, I define as acceptance by members of the stigmatized races of negative messages about our own abilities and intrinsic worth. Now, I have anti-racism colleagues who have pointed out that this is a very one-sided definition, because they say, what about the internalized sense of entitlement that many white people walk around with? Isn't that also internalized racism? And yes, it is. So I'm going to pack it off with my institutionalized stuff for a minute. I'm not going to address that specifically this morning. Here I'm speaking from the point of view of members of the stigmatized races and how this internalized racism can be detrimental to our health, which starts with self-devaluation, feeling maybe I'm really not as good as. Maybe I shouldn't try to graduate from high school or apply to that college or apply for that job or try to live in that neighborhood. In fact, this self-devaluation often manifests as fratricide, black on black or Latino on Latino crime, because if you don't value yourself, you won't value somebody who looks very similar to you, and you might as well off them as not, right? The white man's ice is colder syndrome. That phraseology comes from my parents' generation, and during that time, that attitude was very prevalent, but it's still present today for many of us. And so what does it mean? So say you're a person of color and you need a doctor. Say you're black and you need a doctor. You might go seek out a white doctor over a black doctor, right? Or if you needed a lawyer, you might go look for a white lawyer over a black lawyer. In fact, if your lemonade was warm, you might go way down the street to get the white man's ice over the black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. Internalized racism turns into resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors, turns into not registering to vote, turns into not voting even if you are registered. And come on, people, we cannot let that happen now. It's too important, right? And really, internalized racism is about members of stigmatized races accepting the limitations to our own full humanity of the box into which we've been placed. So that when you hear young high school students of color, and one of them's trying to be the valedictorian, and the others are saying, well, you know, so-and-so is just trying to be white, we need to challenge that, because since when did white people claim exclusive access to excellence? They did not. So now I'm going to illustrate these three levels of racism with one of my teaching stories, my Gardener's Tale allegory. How many of you are familiar with the gardener's tale? Okay, so we have about 5. So for you all who've heard it before, I challenge you to listen with different ears so that you can pick up little nuancy things for when you tell it back, okay? But for the rest of you, let me just first preface it. I'm not even going to start with the story. I do a lot of storytelling where the images are coming from things that I've seen with my own real eyes. So first I'm going to tell you what I saw in my own life, and then we're going to make it a story about racism. So my husband and I, newly married, moving back to Baltimore, and from Detroit, so I mean a lot of my cities were represented on that first panel. But moving back to Baltimore, so I could finish my PhD at Hopkins, we bought our first freestanding house. Cute little house with a big wraparound porch, with flower boxes dotted all on the porch. And we bought the house in October, so we weren't even thinking about planting anything until spring came, but when spring came, we were all excited, going to decorate our cute little house. So we run out with our marigold seed ready to plant, and then we saw that some of the boxes had dirt in them and some of the boxes were empty. So my husband dutifully goes down to the gardening store, and he hauls back big old bags of potting soil, and we fill up the empty boxes. Then we take equal numbers of our marigold seeds, and we put them in all of the boxes, and we water them. And, you know, I'm not the gardener in the family, so by that point, I'm exhausted, so I just sit back, right? I'm just going to be delighted at the outcome. But about 3 weeks later, I walk out of my front door, onto my porch, getting ready to go to work, and I looked at my flower boxes and stopped in my tracks because as I looked at those flower boxes, it looked to me like we had planted completely different species in some boxes versus the others, because some boxes were full of plants and the plants were tall and vigorous looking. And other boxes just had a few plants in them and they were scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had brought turned out to be rich, fertile soil, so that every single seed planted in that potting soil and that rich, fertile soil had sprouted, where the strong seed had grown very tall and vigorous, and even the weak seed had made it halfway up. But that old soil that we had found there turned out to be poor, rocky soil. So the weak seed planted in the poor, rocky soil just died, and even the strong seed in the poor, rocky soil had to struggle to make it to a middling height. Now, I see some of you guys nodding out there, so thank you. There are some gardeners here, especially we just had the whole, urban ag and all of that. So you guys know, maybe you've composted half of your garden or whatever. You know that this is an image about the importance of the soil, the importance of the environment. But now, I'm going to make this a story about racism by introducing a gardener. So now we're going to have a gardener who has 2 flower boxes, one which she knows to have rich, fertile soil, and one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms, and the gardener prefers red over pink. So what does she do? She takes the red seed and she puts it in the rich, fertile soil, and the pink seed she throws over in the poor, rocky soil. And 3 weeks later in her flower boxes, she sees what I saw in mine. In that rich, fertile soil, all of the red seed sprouts. Strong red seed, tall and vigorous. Weak red seed makes it at least halfway up. In that poor rocky soil, the weak pink seed just dies. And here comes the strong pink seed, struggling to make it to a middling height. And then in those 2 flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year, after year, after year, after year, the same thing happens until finally about 10 years later, the gardener's looking at her flower boxes and she said, I was right to prefer red over pink. So we interrupt the story to say the first part of this story is how institutionalized racism works, where you had the initial historical insult of the separation of the seed into the 2 types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up to say, well, where is personally mediated racism in the garden? So here we have the garden, and the gardener's looking over at red, and she just loves red. And then she looks over at the pink flowers, and she says, oh, those pink flowers sure are scrawny and scraggly, so she plucks off the pink blossoms before they can even go to seed. Or she might notice that a pink seed has blown into the rich, fertile soil, so she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not understanding or acknowledging that they're benefiting from enriched soil. Pink flowers are looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, and the bees are just minding their own business, collecting nectar and pollinating at the same time. So here comes a bee, bzzz, into one of the pink flowers, and then bzzz, into another pink flower, then bzzz, to this other pink flower, and this flower's like, get away from me, bee. Don't bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we could go over to the pink flowers and say, pink is beautiful, power to the pink. And that is an important intervention. That is an important intervention, not making light of it. But if that's all that we do, it's not going to change the situation in which the pink flowers find themselves. So you say, okay, let's address the personally mediated racism. Let's have a conversation with the gardener. Or better yet, let's have a workplace multicultural workshop for the gardener. It's all good. It's all good. I do them, right? Okay, so we have our workshop with the gardener, and then we say in the workshop, dear gardener, would you please stop plucking those pink flowers? And maybe she will, and maybe she won't. But even if she does, it's still not going to change the situation in which the pink flowers find themselves. I think that if we really want to set things right in this garden, we need to address the institutionalized racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although in my mind it makes it easier going forward for the gardener to continue segregating resources. But if you keep separate boxes, it means that you need to enrich that poor rocky soil until it is as rich as the rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. And in fact, just think about the fact that those seed have been selected for survival and strength. So they'll be looking really beautiful, grand, and glorious, at least as good as the red. I don't usually say that, okay, but.
Two.
Yeah, that did happen. Okay, now maybe turn it down a little bit because it's a little echoey for you guys. Okay, so talking, this is good right now. Okay, so what I was saying is that in the intervention on the institutionalized, you'll also have addressed the internalized, pink not looking over at red, thinking red is better, and you may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful will be less likely to have that kind of attitude. So this story has been to illustrate these three levels of racism: institutionalized, personally mediated, and internalized, and to very strongly suggest that if we want to set things right in the garden, we need to at least address the institutionalized racism. Good to address all the levels at the same time, but at least address the institutionalized, and when we do, the other levels may take care of themselves. Now, before I leave this story, there's one more question that we haven't discussed yet, which is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act or agency, and control of resources. And those three things taken together in my mind are the elements of self-determination, right? Who is the gardener? Well, government is a big part of the gardener. In fact, I tell people this slide used to read, who is the gardener? Government, power to decide, power to act, control of resources, until I went to work for CDC, at which point I changed my slide. But anyway, right. But government's a huge part of the gardener, and some of you guys are in government or working with government. But it's not the only part of the gardener, actually. Media, foundations, corporations, communities, to the extent that they have self-determination, can all be part of the gardener. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. And our challenge is what to do about the gardener. Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions that can come out of this. And actually, I just want to touch briefly on two questions that came up before. One of which was, after I told this story, somebody in the audience, said, Dr. Jones, why should the red flowers share their soil? I was like, good question, right? Good question, first of all, because it shows the power of this story to start conversations on racism. That if we were talking about racism between you and me, that question would never even come up. But my answer to why should the red flowers share their soil is that actually that soil doesn't belong to the red flowers. It belongs to the garden. That's a revelation for some, but it is the truth. The second thing is, though, what if that's not the original gardener? What if that's the gardener's great-great-great-great-grandchild? Here we are. What then? Because that great-great-great-great-grandchild has grown up seeing the flowers looking like that, may not even think there is an issue, a question to be answered, a problem to be solved. And so there are three things I want to hit on quickly with that. First is the importance of making the differences in the height and vigor of the pink and red flowers a problem. On the health side, we have done that, well, back in 1998, the 16th Surgeon General, Dr. David Satcher, and President Clinton at the time, announced an initiative to eliminate racial ethnic health disparities by the year 2010, right? Well, that changed the national agenda on the health side, because before that, in our healthy people plans, if this was black infant mortality rates and this was white, the goals were always like this, right? But that changed it, so the goal was to do that, to eliminate that gap. But we didn't eliminate health disparities by 2010. We're in 2016. We missed that, not because we didn't put a lot of energy and intellect and resources in it, but it's because we still haven't been, addressing this weed by the roots. So the second thing I want to say is, in order to do that, we have to understand the differences in the quality of the soil. So we need to make those flower boxes transparent, right? But then the third thing, when we make the flower boxes transparent and we talk about the differences in the quality of the soil, we also have to be clear to highlight that the pink seed did not just jump over into that poor rocky soil, right? So we have to talk about history and the gardener's agency in all of this. And in fact, this story used to always be about the soil, enriching the soil and all, until in the telling one day in an audience like this, it occurred to me that it was the gardener's initial preference for red over pink that set up the whole situation. And even if we were to compel the gardener to equalize the soil, and not equalize, to provide resources according to need, to make the soil equally beneficial for both things, even if we were to compel that today, if the gardener continued to prefer red over pink going forward, she would continue to privilege red over pink going forward, so that we also need to address that values piece. We need to address the gardener's initial preference for red over pink, the cultural racism, if you will, or the white supremacist ideology, if you will. That has to be part of our work. And you remember how I defined racism as a system of structuring opportunity and assigning value? I never used to be in the values side of the house, but we must address that. We must, especially today, because we have politicians who are out there trying to say, make America white again. Great again, excuse me. But that is what his supporters have heard. It took me 2 months to figure out, what is he saying? It took them 1 second to hear what he was saying, right? It's very important. So now, I said that I wanted to give you tools to think about how is racism operating here, because I'm clear that racism is not a cloud, it's not a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms which are in our structures, policies, practices, norms, and values, where the structures are the who, what, when, and where of decision-making. These are all different elements of decision-making, because that's where the power is in decision-making. So structures are who's at the table and who's not. And whenever you're at a decision-making table, you should look around and say, who is not here, who has an interest in this proceeding, and then find them a way to the table, not just a way to represent their interests. And when I think about the city as health policy as our theme today, we're on the policy piece, but the who is making the policy, the inclusion aspect, still might get lost unless we're very intentional about that. So structures are the who, what, what's on the agenda, what's not. The who, what, when, and where of decision-making. Policies, what we're talking about today, are the written how of decision-making. But then again, we have to get used to seeing the absence of. So we can look and review, health and all policies and, all of this, and health impact assessment of, transportation policy and the like. But what else could be put in place? What are the absent policies that could be put in place that would be very beneficial? And then if policies are the written how, practices and norms are the unwritten how of decision-making. Much harder to tap, but very, very important. And then values are the why. And as I said, we have to be about addressing these values pieces. That used to be off my plate, but I understand now that that piece that Gartner's initial preference for red over pink is what's sustaining this system. The definition that I gave of racism a bit earlier can actually be generalized to be a definition of any system of structured inequity. So what is sexism? That's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages some, unfairly advantages others, and saps the strength of the whole society. And there are many axes of inequity going on in our society today, intersecting in communities and in people. Here's a partial list, and all of these are operating as at least as risk markers for how opportunity is structured and how value is assigned, even as there are also some of them risk factors in the progression to disease. So now that I've shown you this, you think, oh, I've blown my whole argument that we should focus on race and racism, right? But I have not, actually. And the reason that I focus my work on race as the axis of inequity and racism as a system is because it is foundational in our nation's history, and yet most people are in denial of its continued existence and its continued profound impacts on the health and well-being of the nation. So that is why we must put that at the forefront. We must name, measure, and address the impacts of racism on the health and well-being of the nation, even as we acknowledge these other things and are in coalition with people addressing these other things. Because to the extent that we can dismantle racism, we figure that one out, all of these others will come unraveling as well. So, health equity, that's the new thing on the health side. Social equity really is what we should all be talking about. So I'm going to define health equity, and we could just change health for social, and you'll have a good definition. This is a three-part definition. What is it? How do we get there, and how is it related to health or social disparities? I define health equity as assurance of the conditions for optimal health for all people. Social equity would be assurance of the conditions for the optimal health and well-being of all people. This differs from the Healthy People 2020 definition, which starts out that health equity is attainment of the highest level of health for all people. That is our goal, I agree. But what if we hit that last Sunday? Are we done? And in my mind, health equity is not an outcome, it's a process. And which process? Assurance, which actually is one of the three core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health: food, agriculture, criminal justice, education, housing, labor, all of that. For whom? For all people. That makes it equity. Achieving health equity requires at least these three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And I really appreciated the comment about equal is not fair. That's absolutely right. We need to provide resources according to need. And how is health equity related to health disparities? Well, on the health side, health disparities are the differences in the height and vigor of the pink and red flowers, or counting the numbers of different colored bodies at the bottom of the cliff. Health disparities will be eliminated when health equity is achieved. I want to give you one more tool. This is a policy tool that I'm going to ask. Has anybody ever heard of the International Convention on the Elimination of All Forms of Racial Discrimination? Hey, about 6 or 7, 8. Wow, this is great. This is great. What is it for the rest of you? ICERD, the International Convention on the Elimination of All Forms of Racial Discrimination, is an international anti-racism treaty that was adopted by the UN General Assembly way back in 1965. Right? What's that, 51 years ago? Who knew? Who knew there was an international anti-racism treaty? Okay, well, so let me ask you. You think the U.S. signed this treaty? Surprise. Yes. Yes, the U.S. signed it the next year, 1966, as soon as it became open. But the key there, of course, is that our diplomats can go and sign any treaty they want, but it doesn't have any impact unless the Senate ratifies it. That's the trick. We have some treaties hanging out there, that. So, do you think that this is one of those treaties hanging out there? Do you think the U.S. Senate ratified this treaty? It's a trick question because, yes, the U.S. Senate ratified this treaty 28 years later in 1994. And what that means is that today we have international treaty obligations to do right under this 9-page treaty. One of the obligations is to submit periodic reports. So our State Department, every 6 years or so, we're sometimes late, but every 6 years we submit a report to a UN committee. This last report was 69 pages. It's interesting reading because it's saying how we're doing, right? The committee gets that, and it gets like lots. Anybody else, any of your groups, agencies could submit a parallel report, shadow report, alternative report, whatever you want to. In 2014, the committee considered not only the U.S. State Department report, but 82 parallel reports, and then sent back in September of 2014 their concluding observations. It's only 14 pages. I hope that each of you read that this weekend. And the concluding observations go something like this. Thank you, dear United States, for your report. We remain concerned about racial profiling, residential segregation, the achievement gap in education, differential access to health care, disproportionate incarceration, and on and on and on. And not only we remain concerned about, but with specific action steps, specific recommendations that we as a nation are duty-bound under this treaty to address. It also has recommendations that say, dear United States, you need to adopt a national action plan to combat structural racial discrimination. Wow, right? This is the third concluding observation. This is the first one where they've made that recommendation. I actually think that our APHA, National Campaign Against Racism, is a little private thing to help prop that up. You know, that's part of what we can do. They also say in the concluding observations, dear US, you need to let your people know about the existence of this treaty. So now every time I talk, I do my part, right? And I want you guys to do your part. You know, put it on your Facebook or your web pages and all. In fact, you can actually link, we have a website now. The American Public Health Association has an active website, apha.org/racism, which is just in its infancy. But you can go there and get some resources, including the treaty and the concluding observations and like. And you can also suggest resources to us. And we're about to launch an anti-racism collaborative with 7 collective action teams in these areas. I'd be happy to describe those to you later, but what I want to do is just finishing up in my last few minutes. I want to finish up with 3 more of my allegories. This first one, Japanese Lanterns, Color Perceptions, was sparked by my experience as a medical student when I had been invited to a faculty member's garden party, and I felt all grown up, and it was really lovely. It was in the evening, and the garden was festooned with, you know, Japanese lanterns and colored light bulbs and the like. And as night fell, you know, I got a little weary of chitting and chatting and, you know, having a little snack. So I decided to sit on the edge of the garden and just let the conversation and the music wash over me. And as I sat there at that party, I became fascinated by a group of pink moths. And it was a lovely Zen experience for me. And I was just, you know, it was warm, it's beautiful. And then my gaze shifted and I was like, oh, look at the green moths over there and the blue moths over there. And isn't it interesting how they're sorting according to their kind, right? My first thought, my real first thought, right? But then I said, oh no, somebody else could think that. And other people do think that. And you know, you've seen moths. You didn't realize I could have been in a different part of the garden looking and talking about yellow or purple or orange moths. And you've seen moths under universal light, the little insects, and you know that they're not pink or purple or blue or yellow or green or orange. You know that moths do come in different colors, yes, but they're in different colors of tan and brown and speckled and splotched. And that the lights that I thought, the colors that I thought I was seeing were due to the lights by which I was looking, where those lights were coloring and distorting the true variability of the moths. And then I started thinking about what is race? And how do the racial categories that we construct color our vision of who we are? And this made it clear that race is a social classification, not a biologic descriptor. It's a social interpretation of how one looks in a race-conscious society. And for those of you sitting in the audience yawning like, of course, in a medical audience, this is something that is still under debate. This is still under debate. And actually, you realize that in our society, we hang up black and white and Latino and other lights, and that's what we see. And in another part of the world, we can hang up other lights, and only under universal light will we see our true variability. But in our lights, in this country, it gets especially pernicious when you put nets around the lights. And then, you know, you value one color light more than the other, and then the malls start thinking that they're pink or blue or yellow. So that is our system. Second allegory, dual reality, a restaurant saga. This also sparked by an experience I had as a medical student. Here I was studying with some friends in our apartment, and we had no food in the apartment. It got late, we were hungry, so we decided to go into town to get something to eat. So we walk into town, we find a restaurant, we go in, we sit down, menus presented, we order our food, food is served, here we are eating. Not a very exciting story. But, right, most of us have had this experience. So, but as I sat there eating in this restaurant, I looked across the room and I noticed a sign, and the sign said open, and it was a revelation, right? Okay. It was a revelation about how racism works. And you say, Camara, you still haven't explained it. But here, imagine this. Here I am, sitting at the table of opportunity, looking across the room. I see a sign that says open, and I could have assumed that anybody else hungry could walk in, sit down, order their food, and eat. But I realized, because I knew something about the two-sided nature of these signs, that in fact the restaurant was closed due to the hour, and that hungry people just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, and eat. And all of a sudden, I understood how racism structures open, closed signs in our society, that racism structures a dual reality. And for those inside, sitting at the table of opportunity eating, and they look up and they see a sign that says open, they do not even know that there is a two-sided sign going on. Because it is difficult for any of us to recognize a system of inequity that privileges us. It is difficult for men to recognize male privilege and sexism. It is difficult for white people in this country to recognize white privilege and racism. It is difficult for all Americans to recognize our American privilege in the global context, except that we got a little taste of that with Ebola, did we not? Yet for those on the outside, they are very well aware there's a two-sided sign going on because it proclaims closed to them, and yet they can look through the window and see people inside eating. So for those on the inside who say, is there really a two-sided sign? Does racism really exist? I acknowledge that it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to understand that racism exists. It's an empowering thing. It doesn't compel you to act, but it equips you to act. So that if you care anything about the people on the other side of the sign, then you can talk to the restaurant owner who's inside with you, and you can say, you know, there are hungry people outside. Why don't you open the door? You'll make more money, and oh, the conversations we can have. Or maybe you'll pass food through the door or break through the glass or tear down the sign or whatever you do. You won't be sitting there saying, I wonder why those people don't just come on in and sit down and eat, because you'll understand something about the two-sided sign. The last story that I want to tell, and I'm going to actually come out here, so I'm sorry if whoever's live streaming, you're going to have to follow me. Like, okay, sorry about that. This image actually is not from my own real lives. It's from the book, Why Are All the Black Kids Sitting Together in the Cafeteria and Other Conversations About Race by Dr. Beverly Daniel Tatum, who is the president of Spelman College. In her book, she has an image about what racism is as kind of like people just living their lives on a conveyor belt. They're not trying to be racist, you know, but they're just on this conveyor belt moving through racism and toward racism, but they're not even noticing, right? I want to take that image and I want to expand on that image to talk about how we can become actively anti-racist. I guess there's no thing, so I'm just going to put us on the conveyor belt, and I'm going to go. So here we are, we're on the conveyor belt, just living our lives, you know, going to school, going to work, you know, whatever it is, and moving through racism, toward racism. If we looked up, we'd see a big sign that said racism, but most of us don't look up, we're just self-absorbed. But some of us do look up and they say, oh, racism, and then they close their eyes, right? Right, because they're in denial. Right, so they're still in, oh, they might look up racism and they might turn around, right, but nothing else. And so maybe they're colorblind, but they're still being drawn inexorably into racism. What I'm going to suggest that we do is, let's get back, because I ran out of conveyor belt here. So, so here we are on the conveyor belt. Now we look up, we see racism, and we don't want to go there. So what we have to do, first of all, is to turn around, yes, but then we have to become actively anti-racist. We have to do something. We have to start walking backwards, right? And we have to walk backwards at least as fast as the conveyor belt is moving, not to even go more deeply into it. And let me ask you this. What happens when you're walking backwards on a crowded conveyor belt? You keep bumping into people, right? And they say, hey, buddy, watch out. Watch where you're going. And this is your opportunity to name racism, because they say, what are you doing? You say, do you see where we're going? Do you want to go into racism, or will you turn around and join me? And most people will say, just get out of my way, because they do not want to be disturbed out of their comfort. But maybe one or two will turn. So now you have 2 or 3 of you walking backwards on this conveyor belt, and you keep bumping into people and doing the first stage of being actively anti-racist, which is to name racism. And more will turn with you. Never 50%, don't even hold out for that. But as more and more turn, now you have some kind of critical mass. And so now you're not just going to stay in the same place. Now you can actually make some progress, not only away from racism, but toward the motor that's running this conveyor belt, which is very important. And here it is. We found the motor. And so now this is the second stage of being actively anti-racist, which is to ask the question, how is racism operating here? Looking at structures, policies, practices, norms, and values. And I see how it is, and it's this lever. So I pull on the lever, and the whole system starts shaking, and I did it, except racism is a very fancy system. So it reconfigures itself, and it keeps on going, which points out the importance of the third stage of being actively anti-racist, which is to organize and strategize to act. And so as I'm pulling on this lever, I need you to push a button, and I need you to spin a dial, and I need you to push that lever back and forth, and all of us need to take a piece of this, and I do earnestly believe that working together we can all dismantle this system and put in its place a system in which all people can know and develop to their full potentials. And that is our challenge, especially today. So I hope that you guys will join us, the American Public Health Association, in our national campaign against racism. Go to the racism website, and in about a month, hopefully, you'll find a way to plug into this anti-racism collaborative. And actually, in all of our works, if we could name racism, ask, how is racism operating here? And organize and strategize to act, each of us taking our pieces in food and housing and transportation and all of that, I think we can really dismantle the system. That's our challenge, and please join me. Thank you very much. And I don't know if we have time for questions or not. Yes, I would love to take your questions. Also, I'm going to put my put my stuff there. Okay, so are there any questions? Or comments or suggestions or...
Thank you, Dr. Oh, is this on? Hello? Can you hear me?
Yes.
I don't think
No.
so. No.
No, that one's
It's not really working, I don't think. Test 1, 2, 3.
No.
How about this one? There we
Yes.
go. So thank you so much, Dr. Jones, for another excellent talk. And I guess I wanted to ask about this idea with, you pointed out that most people are in denial about racism. And so thinking about the gardener and this initial point where you said that the gardener plants the seeds in the two different boxes, one which she knows to have, and just that point about one which she knows. So what do you do when the gardener not only doesn't know but actively refutes the fact that the soils are different? Or, I mean, how do you...
Well, so the original gardener, so that's the difference between the history and us as great-great-grandchildren, honestly. And so I guess, the original gardener knew, but the generations of gardeners don't know and would deny and would find other things, especially if the gardeners have a focus on individual plant viability and are not soil scientists. Like I'm told, if you're really a gardener, you're all about the soil. But in our nation, we have three huge barriers to addressing inequities. One is that we're ahistorical, so we don't even ask, what's happened here. The second is we have a narrow focus on the individual, which makes structures and systems irrelevant. And then third, we have this myth of meritocracy. If you were a strong seed, you would make it, type of thing. Like through hard work, if you work hard, you'll make it. Whereas, of course, most people who've made it have worked hard, but not everybody has. But then there are just as many other people, more than those who are working just as hard or harder, who will never make it because of an uneven playing field. But we deny that uneven playing field. So to your question, we have to challenge the gardener to look at the soil, to not just look at the plants, but to look at the soil. And I think we don't, because we as a nation are very much on the individual. We don't look at systems and structures as modifiable. That is the key. So we would rather invest a whole lot in trying to figure out how to change the genome than we would in addressing structured inequities. We either assume, because we're ahistorical, we assume that the current distribution of goods and services is happenstance, right? We don't look into see what caused things. So another thing would be to bring history to any decision-making table. If you're trying to solve a problem, then you should challenge policymakers to say, well, how did this problem come to be this way? That would be a lever into getting into something about the inequality of the soil. But really, it's a willingness, and we have to be pushed to that, to look at systems and structures. We have to look at the quality of the soil, and right now we're not. Those flower boxes are opaque. And we're just looking at seed achievement without looking at the soil. And so I'd be interested if other people have a suggestion about how to concretely do that.
I don't have a suggestion on how to concretely do this. I have a question.
Okay.
So my question is, we're in a very interesting time in this country's history right now, and there are more than I would have imagined a significant swath of people who would say this is all political correctness. This is all about things that happened in the past that really aren't that relevant today. We know from surveys that a majority of Republicans and Tea Party members believe that discrimination against whites is as big a problem in this country as discrimination against blacks is. And we also know that there is a subset, actually, of whites who have lived in poor soil, but who see the problem of the poor soil very differently, I would argue. And so I would like to have your thoughts about how do we engage in conversations with those who would argue we don't want to be a part of this political correctness, and the past is the past, and white lives matter.
Right, right.
Is the
So the big challenge there is that people, all of us are in our bubbles. Each of us lives in a bubble of our work and our children and our schools or whatever. And very rarely do we burst through that bubble to go across town to see that there are other people who are working just as hard, just as kind, funny, generous, smart as we are, who have very different circumstances. And to the extent that people could get out of their bubbles to experience other people's humanities and to learn other people's histories and all, then we would interrupt that. But we're raising our people right now to be consumers, not citizens. So people are not well read, they don't travel, they don't speak more than one language, and we don't know. I mean, we even think, many people in this country would say we have the best healthcare system in the world, right? I mean, like, you can only say that if you don't know. So for those, but we don't want to know. We're not raised to be curious as citizens. So part of it is for people to really become acquainted with other people's realities and other people's histories, and in that way to find the points of commonality and common struggle. But racism, the Gardner is even for those red seed that are in some of that poor soil, the Gardner makes those feel that their redness puts their alignment with the other red. I mean, imagine poor people thinking that a millionaire, a billionaire, whatever kind of, is going to be for their interest. It's a big lie. But that's how racism works, that valuation piece. So politically correct or not, I have to say that I've had luck with the Gardner's tale. At least people can see something and they can ask questions looking at flower boxes, and they can ask the kinds of questions you're asking. But for them to really think that it means something in the real world, they're going to have to move out of their bubble. Otherwise, and people don't, and that's why we have what we have. We have people who watch only one TV station and other people who watch only one TV station, and we don't know the difference. We have people who only listen. Now we have iPods. You can only listen to, or whatever, your music versus, you used to have to listen to the radio at least. So we have very differentiated realities. The bubbles are becoming more plexiglass, and to the extent that we're content, then we will have a very divided society that will not understand other people's interests. Is there? Oh, does somebody else have the mic? Somebody else?
Actually, so we'll take this one last question. I know people want to talk with Dr. Jones, but I'll encourage you to continue that in the break afterwards.
She had a comment and then this question, right? Okay.
I was just going to say that's one of the reasons why it's so important for white people to step up and talk about race and racism in this country.
That's right. And I've had some white people say, well, how can I join this struggle? Well, the main thing is you have to be talking to white people about this. So you can't say, well, how can I go into a community and be part of the you need to go into the white community and be anti-racist. That is the most important role. Because as I said, even if you as an individual are unfairly advantaged by the system, and most people can't see unfair advantage, they can see disadvantage and normal, right? But even to the extent that you acknowledge advantage, it is sapping the strength of the whole society. And we need not white allies, we need white activists in white communities. Yes.
Thanks so much, Dr. Jones, for your talk. It's not a question, it's also a comment. So every time I've read your allegory, The Gardener's Tale, and heard you talk about it, I found it to be very powerful. But I think it's especially appropriate, that you're talking about it here in the Garden State, a state that has tremendous amounts of inequality, even though it's one of the wealthiest states in the country, technically, right, amongst the top 10. And you see, like, some of the roots of this inequality across the state. If you look sort of just spatially at sort of residential segregation and sort of the post-industrial cities in the state, like Trenton, Newark, et cetera, who have experienced tragic economic disinvestment and all of the sort of historical processes that have left them where they are. Abandoned, right? And depressed, and also ignored and neglected by our governor. So it's really just a comment, and hopefully we can continue talking about this throughout the day.
Well, I think inaction in the face of need is one big manifestation of institutionalized racism. So sometimes people were like, oh, you know, I didn't do anything, but inaction in the face of need is a huge way that institutionalized racism works. And so to the extent that you can identify inaction in the face of need and lift it up, I mean, there people will say, I didn't do anything, but yes, that's the problem. Yeah. Thank you all very much, and I look forward to the rest of the day.